record computer, and yes, it's recording. All right. First order of business, if you guys didn't know, CDC said, let's put our mask back on. Oh yeah, it plays at the Park MGM. And sorry to be the bearer of bad news. I don't know if I should bear this bad news, but 3 UHS hospitals says students will be limited next semester because of the rising COVID numbers. This is what I was afraid of. I'm at VHS next semester. I just hope it's not one of mine. Actually, I'm just going to Valley. So if it is, I don't know yet, Megan. It's gonna suck. So since we don't know yet, I think we were instructed to make plans on going virtual, and if they do take some students, it'll be half and half, and So on that note, go get the vaccines, get our numbers down, because it's mainly unvaccinated people taking over our hospital. As I said over in the last group, these COVID patients, mainly unvaccinated. I'm sure there's some vaccinated there, but they're taking over our hospital. So leaving us with minimal room and resources for our patients that are stroke, heart attacks, sepsis, and whatever else. This is frustrating, especially from some of my peers. They are getting tired of same thing. It's like a deja vu from last year. That's why they're offering, I think, $500 extra to work overtime at any of the Valley hospitals. And I was told yesterday at Sunrise, it was an extra $28 an hour or 30, something like that. On that note, here we go. COVID vaccine save lives. That's not really the topic. That's just my thing. Today's topic is about, it's going to be a quick one. The female and male hormones, reproductive medicines that affect these things. Quick review. Not this one. On the female cycles. This is one of the hormones that our medication, the medicines I'm going to talk about, is going to affect. Estrogen. Wait, anybody else? No? Okay. Estrogen, female hormones, this is what controls the world. Produced in the ovaries, placenta, adrenal glands, stimulates the development of female characteristics, and it also prepares the body for pregnancy. The next hormone is the progesterone, produced in the ovaries, placentas, adrenal glands. What you need to know about this hormone is it is the hormone of pregnancy. It is I'm not sure if it's official or unofficial title for it. Next, for the females, for the women's sexual cycle. Where's my mouse? The menstrual cycle. 90% of our students here are female, so you're very familiar with this. But for us guys, it's the menstrual cycle once a month or around once a month. It's the cycle. I don't know what else to say about this, but there's this terminology here, menarche. It's the onset of menstrual cycle at puberty. I have a 12-year-old sitting. What is it?
Menarche. Yeah.
See,
I think
okay.
That's what I'm like.
Hey, I'll buy that because I don't know myself. I have to Google it. I have to look at the book. But so menarche, actually, menarche sounds familiar. So there's that. Next cycle of the women's sexual cycle is the ovulation, when the body is starting to get ready for pregnancy. This is when the biological clock starts ticking and they're ready to have a baby. Next, Then they have a baby, they get pregnant. The ova is fertilized by the sperm. They have a baby and they live happily ever after with their kids running around, daycare and all that stuff. After the pregnancy stage, the biological clock stops ticking and then they go to menopause. This is when the hormones start going off the chains. That typically occurs with older women. Depletion of the female ova results in a lack of estrogen and progesterone. This is what we're going to talk about it, how to replace these things. Next, male reproductive system, and there's parts of it. One thing we're going to talk about this is we'll talk about it later. One thing about male hormones is the testosterone produced in the interstitial, in the testes. It's responsible for many sexual and metabolic effects in the male. Contrary to the menopause in women, there's also the andropause. This is like the menopause for the guys. It's our testosterone level goes down, and it's same with the women. It goes with age, and we lose muscle mass. It's part of aging. Human sexual response, we don't need to talk about this. Now let's talk about drugs affecting the female reproductive system. Oh, great picture. Yeah, I take pride in my pictures. Sometimes I take these pictures myself and I put it on there so it's a personal experience. When I see some old ladies that apply to my storyline, I put it up there so you guys can relate. Next, drugs for the female reproductive system. Sex hormones, they're classified into 4. Sex hormones, estrogen receptor modulators, fertility drugs, and uterine motility drugs. So we're going to talk about these one at a time, starting at sex hormones, which is separated in 2. Sex hormones. It's separated into estrogen and progesterone. With the estrogen, though, here's a few examples. Estradiol, conjugated estrogens, esterified estrogen, estropipate. If you look at them, there's like a common theme that the name, the estrogen is attached to them. So it's kind of within the name. So it shouldn't be difficult to pluck these medicines out of a list if you're going through a list of medications. Indications for estrogen. They're lacking menopausal women. So with these ladies, that menopausal lady I showed earlier, we're going to give her some estrogen because she needs some hormone replacement therapy to get her hormones back in place. So everything else in her body starts working or gets back to working normally. And it's also the key for development of the female reproductive system and secondary sex characteristics. Maybe you're right. Maybe I should use a spell check when I'm doing these things. Contraindications for estrogen. I'm going to go through a couple of contraindications here with each medication, and you're going to see a common theme. I'm almost positive that's going to be on the test. Whatever this common theme is, especially this one, contraindication for estrogen, number 1 is endometrial cancer or estrogen-dependent cancers. It's a type of uterine cancer that involves the lining of the uterus. Other contraindications are breast cancer, idiopathic vaginal bleeding, pregnancy, lactation, and a smoker. You're going to see how that smoking comes into place here, play here in a few minutes. Oh, hypertension. Here's my drug card for estrogen, and nothing much here that I didn't say already. So the next sex hormone is progestin. Same as the estrogen. You can almost kind of see the progestin within the progestin or progesterone within its name. Progesterone, drospirenone, etonogestrel, levonorgestrel. It's kind of within the name, so it's shouldn't be difficult to pluck him out if you're given a list of medications. Indications for this. These medication in combination of the phone blowing up. In combination with the estrogen is the pill. The pill is a combination of the estrogen and progestin. It maintains pregnancy and development of secondary sex characteristics. Used to treat primary and secondary amenorrhea and functional uterine bleeding. Contraindications for progestin. Here comes the contraindications. High risk for embolic events. What I mean by that is mainly DVT, but it could also be any embolic, DVT, PE, embolic stroke, anything that involves a blood clot, because these patients are highly susceptible for blood clots, for embolic events. Other contraindications: pelvic inflammatory diseases, endometriosis, pelvic surgery, renal hepatic disorders, migraine headache, and cardiac dysfunction. If you look at the drug card for progestins, right here on the adverse effect, number 1 on the list is venous thromboembolism, or DVT. So in general, adverse effect of the sex hormones, progestins and estrogen include, there's that thing again, higher chance for embolic events, change in menstrual flow, peripheral edema, increased risk for breast cancer, breakthrough bleeding. Here's a question though. So I'm on a pill and I am ready to get pregnant. What do? Do I stop the pill, start trying to have a baby? What's my instruction, Dr. Joey? What do I need to do if I need to get pregnant? Here's your instruction, Mrs. Jones. Delay conception for 3 months after stopping the progesterone. That is your only instruction, and doesn't mean you can stop. You can start trying from there, from that point. Next, estrogen receptor modulators are used to stimulate specific estrogen receptors to achieve therapeutic effects of increased bone mass without stimulating endometrium and causing other less desirable effects. It's for treatment of osteoporosis in postmenopausal women. Remember, as people get older, and then kind of bones take a hit. And this is one of their treatments. Raloxifene, toremifene are 2 examples of these medications. Contraindications for these medications, for these estrogen receptor modulators. Watch this. There it is. It's the same. Venous thrombosis, DVT, any type of embolic events. Pregnancy, lactation, and smoking. Smoking may or may not be related to the DVT and this medication. So be careful with that. Adverse effect of these medications. It keeps showing up. DVT, hot flashes, rash, nausea, vomiting, vaginal bleeding, depression, and lightheadedness. There's a couple of drug interactions with these medications though. And they are warfarin, Coumadin. Don't think I can take this pill, I'll be okay with I'm low risk for DVT because I'm on Coumadin, but nope, Coumadin and this medication, they don't like each other. So your Coumadin may or may not be effective when you're on this medication. Another thing is high cholesterol. hypercholesterolemia medications, and some anti-anxiety in Valium. So bad news combination of this medication, especially with that blood thinner there, Coumadin. Oh, there's others, Aleve, NSAIDs. So here's my drug card for this medication. Adverse effect, still number one, DVT. It's a big deal. Because before we would see some of these patients come into our hospital with DVTs, between 20 and 30-year-old young ladies, no medical history, but are on a pill. And next thing you know, they have DVT. We would cure them, we would put them on on a heparin infusion while they're in the hospital. And then eventually we're gonna wean them down and send them home with Coumadin. And that's it for the rest of their life. I don't know for the rest of their lives, but at least they're gonna go home on blood thinners and stop this pill. Do something else. The pill is not for you. Next, fertility drugs. Next category is fertility drugs. Here's a couple of examples. Cetrorelix, chorionic gonadotropin, clomiphene, minotrophins. How do they work? They work either directly to stimulate ovulation. That didn't make any sense. They work to stimulate ovulation, stimulate the hypothalamus to increase FSH and LH levels, which pretty much it stimulates the ovulation. Contraindication. Oh, I see where this is going. Contraindication for this medication is, there it is again, DVT keeps showing up. Other contraindications are presence of primary ovarian failure, thyroid and adrenal dysfunction, ovarian cysts, pregnancy, bleeding, of course, allergies, breastfeeding, and respiratory diseases. Adverse effect. Multiple pregnancies. I wasn't sure if this was the drug that the Octomom took many years ago when she was on TV, but other adverse effects include abdominal discomfort, distension, bloating, nausea, vomiting, GI side effects, breast tenderness, flushing, vasomotor flushing, visual changes, and ovarian enlargement. The last one of these is the uterine motility drugs. It stimulates uterine contraction. It stimulates uterine contractions. We use it either for labor or abortion. If we're going to use it, the medications used for labor are the oxytocics, and for abortion is the abortifacients. Let's talk about the oxytocics first. It mainly stimulates the contraction activity of the uterus. It can also help facilitate placenta delivery and addresses postpartum hemorrhaging. On my notes here, I said, ask me about placenta delivery or non-delivery when we're at clinicals. I think I have something to show you in one of my notes. It might be too nasty to show here on the screen, so I don't want you guys to throw up. It was a real patient we had that went bad. So we documented it, and with her consent, of course, we documented it and sent it to the proper people. And that was good. You see, just ask me about it. How do these medications work? Directly affect the neuroreceptor sites to stimulate contractions of the uterus. It promotes milk ejection in lactating women, prevents and treat uterine atony post-delivery. It's when the failure of the uterus to contract following delivery, which is the most common cause of postpartum hemorrhage. Contraindications for this, Of course, allergies, cephalopelvic disproportion when the head is bigger than the pelvis, complete uterine atony, early pregnancy, coronary artery disease, hypertension, previous cesarean section, hepatic and renal impairment. Adverse effect, uterine rupture, painful contractions, cardiac arrhythmia. Oh, I don't like it when we start messing with the heart. Hypertension, fetal bradycardia, nausea, vomiting, pelvic hematoma, uterine hypertonicity, and one of the important side effects of this medication is severe water intoxication, because this medication also has antidiuretic effects. So you're retaining your fluids. And when that happens, your electrolyte starts getting out of whack. Sodium's boom, 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 potassium, chloride, everything else. And now when you're talking about electrolyte changes, I might have some neuro effects with that. So watch for that. One of the drugs that I hear you guys talk is when you guys come back to your clinicals is oxytocin or pitocin. Monitor contractions for it should be less than 60 seconds every 2 to 3 minutes. If the patient is having contractions for 90 seconds, that's too long. Oxytocin or pitocin infusion should be discontinued. Stop. Okay. And then monitor maternal and fetal blood pressure and pulse. And if the contractions are still going on, we will counter it with some magnesium. It's kind of like the antidote for it. Oxytocin, my adverse effect is severe water intoxication down here. That's what I'm mainly concerned about. On the flip side, aborificans, I can't say that word. I mean, it's a language barrier thing. They're used to evaluate uterine content via intense uterine contractions. This is an abortion drug. There's a lot of abortion drugs out there, but for testing purposes, these are the 3 ones that we're going to focus on. Boom, carboprost, dinoprostone, mifepristone. Mifepristone. Know those 3, please. So it's a drug for abortion. It stimulates uterine activity in dislodging any implanted trophoblasts and preventing fertilization of the egg. Contraindications for this: active peptic pelvic inflammatory disease, acute cardiovascular, hepatic, renal, pulmonary diseases, lactations, scarred uterus, acute vaginitis. Adverse effect: uterine rupture, uterine or vaginal pain, headache, paresthesia, hypotension, vomiting, diarrhea, a lot of GI issues here, backache, fever. So before we end the drugs affecting the female reproductive system, we're going to talk about the tocolytics. It is a drug that slows the uterine activity it is mainly used for preterm labor. And one tocolytic that we're going to cover is terbutaline. I'm not in the L&D world, so I've never used this in the L&D world, but I am very familiar with this medication because we also use this in my world. This is a medicine that will delay the arrival time of the baby, but it's not going to prevent labor. This is why I'm very familiar with this medication, because of its other uses. Because it activates beta receptors, which causes bronchodilation, So we use it for these patients, our COPD and asthma. We give them to these patients. Of course, when you're talking about these beta receptors, same side effects: tachycardia, angina, restlessness, tremors. Contraindications for this terbutaline is gestation is more than 34 weeks, meaning we can't delay this pregnancy anymore by giving you this medicine. You are ready to go have a baby, and we can't stop it. There's more than 34 weeks. You're done cooking. Cervical dilation, more than 6 centimeters. Other tocolytics. Like I said, I'm not familiar using these medications, but these I am, the other ones. So I'm guessing the drugs we use for our cardiac patients, respiratory patients, they also use in the L&D world. Not their medicine, we use it. Because the main use for a nifedipine is calcium channel blocker. You know, it's blood pressure. Cardine, my blood pressure is too high. Boom, I need to drop it down. Ping, 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 press some buttons, blood pressure goes down. I use this for blood pressure control in a drip form, especially for stroke patients. Magnesium also. Magnesium, with these medications, watch for magnesium toxicity. And in case we give too much, we have an antidote for it, calcium gluconate. And also watch out for NSAIDs when giving these magnesium. Let's talk about the guys. Drugs affecting the male reproductive system. There's not much. There's only 3 types. You have androgens, anabolic steroids, and drugs for penile erectile dysfunction. Number 1 is the androgen. It is the male sex hormones. Testosterone produced in the testes, responsible for male characteristics before puberty. Well, this guy's after puberty. But the androgens produced in the adrenal glands sustains the male characteristics after puberty. Testosterone is the drug name. Testosterone is within the drug name. Look at the drug names here, testosterone. I guess 100% of testosterone is there. Danazol, not that one, but this one, fluoxymestazone and methyl testosterone. Actions for this medication is responsible for the growth and development of male sex organs, maintenance of secondary male characteristics, increased protein anabolism, decreased protein catabolism. Contraindications for this medication, of course, allergies is one of them. Pregnancy and lactations. Why are we talking about pregnancy and lactations with this male reproductive organ, male reproductive medications? Because females also take it. Females who are in this bodybuilding lifestyle, fitness lifestyle, they take it. But they do, but not when they're pregnant. Another contraindications is prostate and breast cancer, liver dysfunction. This is medications. Medication gives a big hit to the liver. And the most important contraindication for this is high potential for abuse. Because if you have because patients feel good when they're on this thing, and I want to keep taking this thing that's going to make me feel good. My liver's not doing well, but screw my liver. Give me the shot, give me the shot, give me the shot, give me the pill. So not indicated for those patients. Adverse effect of testosterone. Boom, sleep disorders, fatigue. I would think I would have more energy if I'm energized and I feel good and I look like that. Androgenic effects, acne, deepening voice, and oily skin. Hepatocellular carcinoma, there's my liver taking a hit. high cholesterol, polycythemia, premature epithelial closure, because some kids, teenagers are also on this thing because they want to look good, they want to look buff. But if they're not growing, it might stop their growth. Next category, anabolic steroids. It's almost like the testosterone. It was developed to produce tissue building effects. It wasn't invented for these big giant bodybuilders to take and so they can get bigger and stronger. It was there's medical uses for it. These drugs are oxandrolone, oxymethylone. I'm guessing this is if you go to the gym and you say, hey, Bobby Joe, I want to get big. I want some steroids. I'm guessing this is what they buy off in the back of the gym. What does it do? Promote body tissue building process, reverse catabolic process, increase hemoglobin and red blood cells mass. And for what? What do we need all these things for? Outside of this bodybuilding people, we actually use it for medical reasons, for anemia. I need to increase my hemoglobin and RBC. Cancer, most of my cancer patients, they're skinny, they've lost a lot of muscle mass. Angioedema, swelling, takes down swelling, weight gain, and tissue repair to get some muscle mass to our patients who doesn't have it. Contraindications, it's the same as the testosterone. Allergies, if you're a female, pregnancy, prostate, liver dysfunction, and cardiovascular disease. Adverse effect of this is excitation. It's not really the excitation I want to put up there, but without having to go through HR, that's as excited as I can get. Hopefully you get the picture. Insomnia, virilization, hepatitis, liver cell tumors, acne, muscularization of females, and baldness for this anabolic steroids. Next, drugs for penile erectile dysfunction. Before I can talk about the drugs, let's talk about penile erectile dysfunction. It is a condition in which the corpus cavernosum, this little orange, not orange, this little pink thing over here, it doesn't get blood supply. If there's no blood supply, it won't get hard. So what these medications do is it vasodilates to get blood flow into the penis so it will get hard. It sounds so simplistic, and that's what it does. It often results from the aging process, vascular issues, or some type of neurological conditions. Drugs. Most of you are familiar with this because you see it on TV. Prostaglandin, alprostadil, never heard of that one. They don't have an ads. I don't see that on TV or magazines, but definitely your Viagra, Cialis, Levitra, you see those on TV or magazines. And that's what's prescribed the most. Actions. Acts locally to relax smooth muscles, vasodilate, getting blood flow into the penis so it will get hard. And that's it. Contraindications for these medications. You can't just take it whenever you want. There's contraindications. One is priapism. This means there's a prolonged unwanted erection, which is, if you're taking Viagra, Levitra, Cialis, you kind of want this erection, right? But in this case, it's prolonged and unwanted into a point that it hurts, and it hurts very, very bad that you have to go to the emergency room. And when you get to the emergency room, we're going to put a Foley in you because we're going to drain your penis of blood because your penis is full of blood. It's trying to go somewhere. It can't. And yes, we will draw blood from your penis to get it back down. Other contraindications, penile implants. I guess you don't need it anymore if you have a penile implant. Bleeding disorders, coronary artery disease, severe hypertension, severe hepatic and renal disorders. Biggest contraindication for this medication is if you are, for the coronary artery disease patients, if you're on nitrates. I remember, I don't even know, 5+ years ago when this Viagra thing first came out, we were getting a lot of patients who takes the Viagra, and next thing you know, they're in RICU because their blood pressure is 50/10 or something like that, something dangerous. Because what it does is when you're taking your nitrates, it could be a nitrobid, it could be nitro sublingual, any derivative of nitro. If you remember from anatomy, is it vasodilates the vessels around your heart. And when it does that, great. But when I'm also taking my Viagra, pop my Viagra, that's another vasodilator. So that's and it's not a specific to the penis vasodilator. So it's a double whammy for vasodilates my heart vessels. Here comes my Viagra, vasodilates it again. So it's a double whammy vasodilator, and my blood pressure is gonna go home. It's gonna get bottomed out. How we treat that is we're gonna give you some boluses, some pressors, and wait until this medication just kind of flushes out of your system. That can take up to a few hours, actually, up to 8 hours. And then that's it. That means this medication is not for you. Either get off the nitrates if you want to keep taking the Viagra, or get off the Viagra, do something else. One side effect of these medications are, it's same from earlier. I don't know if this desired effect or adverse effect, priapism, but then again, it's an adverse effect if it's unwanted and uncontrolled erection that it gets so bad that it hurts and you have to go to the ER. It also increases risk for MI in these patients. So on that note, that's it. That's all I got. I told you this is going to be quick. Male and female hormones, sexual hormone, medications. And that's all I got. Questions I had was, yes, I started doing the, actually I completed the review, the Google Doc review for the finals. In case I haven't told you, I decided not to do comprehensive. So it's just the new stuff we over the past couple of weeks, which is GI, sex, female hormones, medications. I forgot the cancer medications, I believe. And next week is vaccines. My favorite topic, vaccines. Any questions, comments, suggestions? Is it? Oh, that was under 45 minutes. No questions, no questions on the menopausal medications. Okay. Because it may apply to some. Okay. All right, guys, on that note, I will see some of you on Thursday and Friday. And I think I heard, oh, I think the last one, they were, yeah, Jeff was telling me in the AM group, their clinicals just went pop. They just told them to not come. So hopefully it doesn't affect us. Actually, it's okay if it affects us now, it's towards the end, but for the upcoming, that is gonna suck big time. You're welcome, Miss or Mr. 500 5954 418. Thank you, LA, for signing the release, for using somebody that looks like you. All right, see you guys.